A 72-year-old man presents to the clinic with progressive difficulty hearing conversations, especially in noisy environments. He reports that he frequently asks people to repeat themselves, particularly when speaking in a higher-pitched voice. He has no history of loud noise exposure, ototoxic medications, or recent infections. Physical examination reveals Weber test, midline, no lateralization, air conduction, bone conduction bilaterally. Which of the following is the most likely underlying cause of this patient's hearing loss? A. Endolymph accumulation in the inner ear. B. Destruction of stereociliated hair cells at the cochlear base. C. Otosclerosis with fixation of the stapes. D. Dysfunction of the eustachian tube. E. Inflammatory demyelination of the cochlear nerve. Answer B. Destruction of stereociliated hair cells at the cochlear base. This patient has presbycusis, an age-related bilateral sensorineural hearing loss affecting higher frequencies first due to degeneration of the hair cells at the cochlear base. Pathophysiology. With aging, progressive degeneration of the organ of Corti leads to the loss of high-frequency sounds first. The cochlear base, near the oval and round windows, detects high-frequency sounds, so it is affected first. The cochlear apex detects low-frequency sounds, which are preserved longer. Clinical features of presbycusis: gradual, progressive, bilateral, symmetric hearing loss, difficulty hearing higher frequencies, e.g., women's voices, alarms, consonants like S or T, difficulty understanding speech in noisy environments. Weber test, midline, no lateralization since loss is bilateral. Rennie test, ACE-BC bilaterally, sensorineural hearing loss pattern. Risk factors: aging, most common cause of hearing loss in elderly, genetic predisposition, cardiovascular disease, affects cochlear microcirculation, treatment, hearing aids, if severe hearing loss, cochlear implants for profound hearing loss. Why not the other options? Option, why incorrect? A. Endolymph accumulation in the inner ear, seen in Meniere's disease, which presents with episodic vertigo, tinnitus, and low-frequency hearing loss. C. Otosclerosis with fixation of the stapes causes conductive hearing loss with bone conduction, air conduction in Rennie test. Typically affects young adults, 30s to 40s. D. Dysfunction of the eustachian tube associated with middle ear effusion, leading to conductive hearing loss, not sensorineural loss. E. Inflammatory demyelination of the cochlear nerve could be seen in multiple sclerosis, but MS typically causes unilateral hearing loss with additional neurological symptoms. Take-home point: presbycusis is the most common cause of age-related hearing loss, characterized by bilateral, symmetric sensorineural loss affecting high-frequency sounds, first due to destruction of hair cells at the cochlear base.